This video covers Ataxia Telangiectasia. There will be some questions at the end. Ataxia Telangiectasia is an autosomal recessive disorder that has defects in the ATM gene, leading to failure to detect DNA damage. Because of that, it halts the progression of the cell cycle, resulting in mutations accumulation. Ataxia Telangiectasia presents with Triad, Cerebellar defects, ataxia, spider angiomas, telangiectasia, EGA deficiency leads to extreme sensitivity to radiation, limited X-ray exposure. Ataxia telangiectasia findings: increased serum alpha fetoprotein levels, decreased of IgA, IgG, and IgE. Lymphopenia, cerebellar atrophy. Increased risk of lymphoma and leukemia. Please review Ataxia Telangiectasia in the first aid book. Remember, a spider onto a taxi hit the ATM machine. Let's enhance our memory with some questions. Question 1. A 7-year-old boy presents with difficulty walking and frequent infections. On examination, you notice ocular telangiectasias, a tremor, and ataxia. Which of the following is affected? A. RAG mutation. B. ATM gene. C. BTK gene. D. STAT3 gene. E. AIR gene. F. WAS gene. The answer is B. ATM gene. The clinical presentation of ataxia, ocular telangiectasias, and recurrent infections in a young child is highly suggestive of Ataxia telangiectasia, an autosomal recessive disorder characterized by cerebellar ataxia, telangiectasias of the conjunctiva, recurrent infections, and an increased risk of malignancy. Ataxia telangiectasia had defects in the ATM gene. Question 2. Which of the following laboratory findings is most commonly seen in patients with ataxia telangiectasia? A. Elevated creatine kinase. B. Increased serum alpha fetoprotein levels. C. Hypoglycemia. D. Hyperbilirubinemia. The answer is B. Increased serum alpha fetoprotein levels. Ataxia telangiectasia is characterized by increased levels of serum alpha fetoprotein, a tumor marker, which is seen in up to 95% of patients. Elevated creatine kinase, hypoglycemia, and hyperbilirubinemia are not typically seen in ataxia telangiectasia. Question 3. Which of the following is the most appropriate diagnostic test to confirm the diagnosis of ataxia telangiectasia? A. Nerve conduction studies. B. Electromyography. C. Brain MRI. D. Flow cytometry. The answer is D. Flow cytometry. Flow cytometry is the most appropriate diagnostic test to confirm the diagnosis of ataxia telangiectasia, as it can detect the characteristic immunological abnormalities seen in the disease, including a reduced number of T lymphocytes and an increased number of B lymphocytes with abnormal surface immunoglobulins. Nerve conduction studies and electromyography are not typically useful in diagnosing ataxia telangiectasia. Brain MRI may show cerebellar atrophy, but it is not specific to ataxia telangiectasia. Thank you so much for watching. Please watch other immunodeficiencies videos. And, please subscribe, comment, and like. Don't forget to share this video with your classmates. See you in the next video.